Thanks, Kathy, and thanks to everyone to joining. Wanted to get the word out just that cases are slowly increasing across the community, just like we are seeing nationally. Louisville throughout the whole pandemic has gotten hit later. So just like how we saw cases increasing on the East Coast a couple weeks ago, we are seeing that same thing here now. So to bring up the dashboard. So we are in the yellow medium risk, and that is because the number of cases has increased here in Jefferson County. If we were doing the old community levels, we would be in the red for the number of cases we're currently having. But our hospitalization numbers are still low, and so that's why it's in that yellow category with the new CDC levels. So we had 1,771 cases reported last week, which gives us an average incident rate of 33. And then with the CDC one, which is per week, it's 215. 13 deaths were reported last week to the health department. And you could see here on the graph that total cases per week, you could see here nowhere near the Omicron surge, but our cases are slowly starting to increase here in May. And then the deaths, you could see here, even though we report by the number of new deaths reported to us per week, on the graph, it shows you the date of death. And so while 13 deaths were reported to us last week, 4 were just in last week, but those numbers tend to be delayed 3 to 4 weeks. So we expect that to increase a little bit as well too. Vaccination rate, that's the big message. That with the cases increasing, we really want to make sure that everyone is getting their vaccinated and then their booster and then their second booster if they're eligible. And so anyone over the age of 65 and those over 50 with any sort of chronic medical condition qualify for that second booster. And so just encouraging, if you have not gotten that yet, now is the time to do that with the case counts increasing here in Jefferson County. And just like the whole pandemic, the areas of town that are having higher rates of vaccination, you can see that in the graphs. Hospitalized patients, the data is a little bit delayed here. So probably the most accurate data is to look at the 7th when there was about 50 cases in the hospital. And we expect the numbers right now to be about the same as people catch up from over the weekend still. So those last couple of days are still not accurate at the moment. But still way those numbers, that's why we're in that yellow category and not the red, is because hospitalizations still are low, but that may increase in the next couple weeks. And then the last thing, just want to highlight, we have added wastewater data to the dashboard, just in case you hadn't seen that yet. That is at the bottom. And so the level of COVID in the wastewater is about equal to the height of Omicron. And this is kind of what we're seeing across the country as well too. And so it's kind of plateaued here this last week. So just really high levels. And so anyone who doesn't have any sort of immunity, whether from prior infection or immunization, just continue those same cautions. The other big thing besides just making sure you get your booster, we are in a totally different stage of the pandemic now where there are many medications and treatments that are available, so people don't need to get as sick as they used to. And so if you are in that higher risk category, if you have autoimmune issue, any sort of chronic disease, or over the age of 65, now's the time to start planning ahead and talking to your physician or your primary care provider, and just have a plan in place in case you do test positive on a home test or somewhere, or think you've been exposed, so you can get those treatments really quickly, because they like to get them started in the first couple of days of having COVID. So just have that plan in place in case something does happen. Make sure you are testing. Testing at home is still good. They're free tests from the government. If you haven't gotten them yet, you can order your second set. Make sure you do that. Otherwise, they are available over the counter across the community and at other places as well too. But so if you test positive, contact your doctor and make sure you have treatment if you're in the high risk categories. And then if not, just the same thing, stay home. Don't want you to transmit it to other people. If you do use the home test, sometimes they don't turn positive for a couple days. So as long as you have symptoms, please be staying home. No matter what it is, if it's a flu or just another virus, still don't want you transmitting that to others. So if you feel sick, stay home. And if you got to go out in the community and you're high risk and you're around other people in close quarters, wear a mask, especially if you're in those high risk categories. And I think there's a ton of questions. Kathy, I don't know if you want to turn it back to you to go
Yeah,
over
sure.
them, or I can read them.
I'm happy to do that for you. I just had a thought about something I thought you might wanted to re-emphasize, but we'll just grab the questions. So Jamie is asking, what is the weight people should be taking between booster shots?
So it depends on which type of booster. If you're having one of the mRNAs, so the Moderna or the Pfizer, it's 4 months from your first booster if you're over the age of 50, or if you're older, the age of 12 and are moderately severe immune compromised, you can get your second booster 4 months after your first booster. And then if you had the Johnson & Johnson or the Janssen vaccine, that is also 4 months afterwards for that booster.
Okay, and then April Rickard is asking, Dr. Moyer, can you clarify wastewater is showing levels close to the peak of Omicron, and this is mainly BA2?
That's correct. It's mostly BA2, and we're still the trends are high, but you've probably seen like the cases, the hospitalization numbers being low, and then numbers not increasing exponentially. I don't think we're in the same situation as we were in January. Lots of us have immunity to Omicron, either from vaccination or from getting it back in January. So different situation, but yes, and still the science totally isn't there yet. So working with our researchers at U of L to just try to kind of figure that out, whether if there's a difference in the wastewater with BA2 or with more people in town right now with all the events from Derby, that can influence it as well too.
And Dr. Moyer, the with Omicron, while it is really highly contagious, it is true across the country that we're seeing it has creates less severity of illness for people. Is that correct? Unless someone is immune compromised.
Yeah, so I mean, that's partially correct. So there's less severity because we have immunity already to it. So whether that is because you got Omicron when the first surge went through with BA1, or if that's because you've been vaccinated and boosted and gotten your second booster, it's milder. It doesn't mean you can't get it, but the case like feels more like the flu instead of having to get hospitalized. If you've never been exposed, whether you've never been vaccinated, never have had COVID in the last 2 years, it's just as severe as it was the first time around. So those are the people we're really trying to protect right now.
Okay. Bobby is asking, are you expecting a big post-Derby surge? And Dr. Moyer, would you say that it's a lot of factors might go into the spread right now? There's, not mask wearing. There's lots of activities happening. Do you attribute, you expect a post-Derby surge, or is this more of living with COVID-19 now?
That's a tough question. So I think it's a combination of everything, right? So I mean, we're seeing increases across the country. So it's not just Derby, but people are more relaxed. We've got better treatments and other things happening, and so numbers are going to go up. Hopefully, those hospitalization numbers stay low, and that's really what we're trying to prevent in this stage of the pandemic. So expect numbers to increase, but hopefully, with all the other tools we have, the hospitalizations won't. And so yes, Derby, more people are traveling, going back to work, getting together. And so we're seeing not just increases in COVID, but flu's also increasing, RSV's increasing. All the other viruses are also increasing as we get back together, as expected. So lots of great things we learned from the pandemic in the last 2 years. So if you don't like getting viruses like that, make sure you're washing your hands, wearing a mask, staying away from others, because those things we know work.
Okay, thank you. And I think that I think, Dakota, that we've answered both yours and Bobby's question just now, but if not, feel free to put something back in the chat. And then Bobby is saying that the CDC's map shows Jefferson County still in the green. Is the map the health department uses more accurate?
Great question. So the CDC updates their map on Thursdays and we update ours on Sunday. And so I do expect with the increased number of cases that we will likely be in the yellow on the CDC's map in this Thursday's update. But we'll see too if the trend goes back down, if we get less cases reported today and tomorrow, we might be back in the green again. So we'll see what happens. But we're right on that border.
Okay, thank you. And then Jamie's asking, with the rise in cases and gatherings during Derby, how important is it for people who were in large groups to get tested?
So I think if you have symptoms, it's really important to get tested, just to know and to stay home until you get that result back. And then either you have a couple days to do a second test if you're doing the home antigen test, if the first one's negative, or until your symptoms resolved. And then the other really important time to get tested is if you're going to be around somebody who is immune compromised, if you're going to go visit a relative in a nursing home, or you're having people over that are over the age of 65 or might have other reasons, then I would test before you see them. So just to make sure you're not getting them sick.
Also from Bobby, you said masks are still a good tool, but do you think people will go back to that protection method?
I still see people wearing them now. I think it's a great tool. If you are in one of those categories that are high risk, wearing it, even if you're the only one in the room wearing it, it still provides a lot of great protection. I think for everyone else who gets colds and feels bad for a couple days, it's risk benefit to them, whether they like to be out of work and out of activities and feeling bad versus wearing it. I think we all have kind of that risk benefit to take on what we decide to do going forward.
And
Ventilation's the other really big one too, that I think we've started talking less about. So just knowing the environment you're in, if you're outside and it's windy and it's great ventilation, maybe don't need to keep that mask on. But if you're in a really tight, crowded indoor space and you don't know the vaccination status or trust that people are there symptom free or not, I would wear a mask right now.
I was going to say the CDC has recently recommended that people using public transportation, people traveling using public transportation, wear masks, correct?
Correct. That's for everyone. So not just like right now in the yellow category, those that are high risk should be wearing masks, but for in public transportation where ventilation maybe is not so great in a confined space, definitely recommend mask wearing as well.
And I think we also want to put a plug that the Lou Health COVID helpline is still there and available. So if someone tests positive and are not sure what to do, they can call the helpline. If someone needs help finding a testing or vaccination location, a test to treat location, they can help with that as well. So I just put that number back in there. All right, I don't see any other questions. Anybody else? Any other questions?
I think that was just a really great reminder. We still have, while the hours might be more limited on the helpline, we still have teams in place that if you do test positive, we can help you get the supplies you need to stay home and follow the public health advice. If you need a place to isolate safely, you can't do that in your own house, we can help you with that as well. So please reach out to us. We can help you find where to get tested, where to get vaccinated. All those things are still available. So please reach out if you need to.
Yeah, the helpline is available Monday through Sunday, 8 a.m. to 8 p.m. I'm going to throw that in the chat real quick. So yeah, just, feel free to help promote that. We have people who can help. Okay, I don't see anything else.